So good afternoon. Welcome to Monday. This is Audrey Russo, President and CEO of the Pittsburgh Technology Council. And I'm joined, as always, with my co-host in all things media, Vice President of Visibility, Jonathan Kirsting. And before we jump into today's call, with deep appreciation of our county executive being able to join us, given everything that's going on, I feel very privileged that he's taken the time. A few things. First of all, we've muted all of you. We've muted you only just to make sure that there's nothing in the background and any noise, any birds, any family, that we are not distracted. The second thing is we have a chat, and the chat is, we use the chat. So use that for an opportunity to ask questions. We'll try to get to those questions. Jonathan will make sure. And this isn't a time for you to sell your wares. We're here to make sure that we're tethering the community and that we're talking about the topics that face our constituents each and every day. That's why we're very thrilled to have Rich here. But before we get started, and I bring Rich right on, I just want to give deep appreciation to our sponsors, and that includes Sheets. Sheets, while they might be headquartered in Altoona, and everyone knows Sheets and the kinds of services that they offer to all of us each and every day, from gas to food. They also have an innovation center that's based in Pittsburgh, and that is focused on all things innovation to the next generation of sheets. Deloitte, we're thrilled to have Deloitte join us this morning as well. They're very active in our community, both civically and professionally, providing lots of services to many of our organizations, and they're deep partners in our region, as well as Huntington Bank, who has been with us right from the beginning and has always been on our side whenever we try new experiments, as well as their leadership in terms of all things related to the CARES Act. And then finally, we have AT&T. AT&T joins us as leaders in making sure that there's, we address the issues around the digital divide. They have been with us also from the beginning as we've tried to gain access, provide access to our regions and particularly our city schools as those schools actually went virtual. So they've been a key member in terms of the partnership there. And they're also a sponsor of our public policy series. So really thrilled for all of them. And for tomorrow, just to let you know that we have Jay Katarinzik, he's managing director of Draper Triangle Ventures. They've been involved in Pittsburgh's tech scene for, I think, 35 years at least. And then on Wednesday, we have David Morehouse, president and CEO of the Pittsburgh Penguins. Thursday, we have State Representative Valerie Gatos. And Friday, we wrap up with Ryan Scott, who leads up Carlos University Social Justice Institutes, which is very timely for all the things that are happening. So enough of me. Now I just want to jump in and thank our county exec, Rich Fitzgerald, who has been very, very busy. It's amazing that they've made themselves available to us, and this is the third time that he's joined us, and he joins us because he knows how important it is to make sure that the communication is strong and that we have some level of intimacy in terms of the kinds of things that he's leading us through and grappling with. So good morning, County Executive, and I like to call you Rich, if that's okay. Absolutely. I know you've had to make some really, really tough decisions over these last few weeks, these last few months. And can you walk us through that? Can you talk to us about, what the progress has been? What are the opportunities? What are some of the issues?
Okay, well, I will take my mask off now, but I wanted to have it on because I think it's so important. We've learned how important masks are, particularly indoors. We've learned a lot about this virus as we're still continuing to learn as time goes on. And it's one of those things that has literally affected everybody. Nobody has not been affected one way or the other, whether they've contracted or had a family member. Their business, their organization, their school, all their activities have just been so affected by this. But yeah, back in mid-March, when the state, as well as Dr. Bogan and the county started to shut things down, and we went into something at the time that was called the red phase. And the red phase basically stay at home, don't go out. And those of you who might have been out driving at that time would have seen no traffic because very few people were out and about. People did stay home as we started to see some of these scary things about this disease, death rates, all kind of things that went on. We in Western Pennsylvania and Allegheny County in particular did extremely well with low cases, low positive cases, low hospitalizations, low intensive care units, low death rate, et cetera, compared to other major urban areas across the country. And as the state started to slowly move into a different phase, the yellow phase, we were granted one of those yellow phases, which started to open things up. It started to open things up in which people could be away from each other, things like construction or manufacturing, certain types of retail, et cetera, et cetera. And we were in that phase for a couple of weeks. And then in early June, we were given the green phase. And I think green in many ways is probably misleading, because those of us who learn to drive figure green means go and everything's okay. And I think a lot of people took that signal as almost a meaning that we had beaten this disease, that we had beaten this virus, and people started to really get lax, not wear their mask. We saw a lot of numbers start to go up. So in early June, we saw the bars and restaurants and hair salons, nail salons, gyms, et cetera, all open up. Pretty much most things were open other than big gatherings like a concert or a sporting event, festivals, things like that. But then it takes a couple of weeks for the numbers to kind of catch up. And then in late June, we started to see our numbers in Allegheny County start to spike. When we were testing early on, we would be 2-3% positivity. Well, starting around June 26th, 27th, 28th, we started to see towards 10% positivity. And we've had over 200 cases on a number of occasions in a day. We would go in May or April, would go 3 weeks without 200 cases total. So it really changed the dynamic. So about a week and a half ago, 2 weeks ago, Dr. Bogan ordered a shutdown of bars and restaurants. The contact tracers and the investigators, case investigators, really isolated the fact that it was the bars and the restaurants that were, mostly the bars, were young people were standing, congregating, not wearing masks, not socially distancing, staying there for long periods of time, which is what, you know, a lot of us do when you go to a bar. And there were also people coming back on travel, places like Florida that started to become hotspots, Texas, California, Arizona, the Carolinas, people bringing the disease back, then going to bars or then going to other places where they would be in contact. So Dr. Bogan and her team shut that down. Just this week, they opened up partially in restaurants where you could have outdoor seating again in restaurants. You could order a couple of drinks. I think it's a 3-drink limit that you can have. You have to be seated, should be wearing your mask, all those kind of things that we all know about. So we've seen a level of plateau. We're around 10 or 11% positivity right now. It hasn't gone up over those 200 into the 300, 400, 500 that, you know, we were fearful that it would occur. But we also haven't seen them come down yet. So we're hoping over the next few weeks, the next few days and in the coming weeks, that we'll start to see those things go down. And then maybe within the restaurant association, restaurant business, there could be even some indoor dining that can open up. I would be very doubtful if we're going to see people be allowed to congregate in bars again in the large numbers that we did. I think you'll see things in which people can go, but they have to be seated. They have to be 6 feet away from each other, those type of things. So the good news is on the economy side, the health department hasn't had to shut down all the other operations, you know, manufacturing, office operations, R&D, you know, all those type of things have still been able to operate, as well as retail, the gyms, the hair salons, the nail salons, manufacturing, construction. Those things have been able to remain open. But I think what it has done is brought back into to focus the fact that, you know, wear your mask, be responsible for everybody. Otherwise, this thing could get out of hand very quickly. We don't want to be like some of those states I mentioned where they're really literally starting to shut things down and their hospital system is being overrun. Ours isn't at that position yet. We certainly don't want to get there.
And so the recommendation is masks outside and inside.
Yes,
correct?
yes. Well, outside, if you're within 6 feet of people. I mean, if you're outside, you know, riding your bike or going for a walk all by yourself out in the park, you probably could take your mask off. But it's the distance, the social distance to keep away from people, but definitely indoors. It's an indoor with a lot of people in a room for a long period of time. That is really the high potential for spreading the disease.
So many people do not realize that Allegheny County is one of the few local governments in Western Pennsylvania that even has a health department. Even the city of Pittsburgh doesn't have a health department.
That's correct.
So, talk about this and how it, helps you to respond and exert local leadership during this crisis.
Well, we're fortunate in that regard because it's tougher for the state out of Harrisburg when they've got 67 counties to focus on, to maybe be as nimble as you can be when you have a health department on the ground with people on the ground with contact tracers, with the relationship that people like Dr. Bogan have with our great ecosystem of healthcare that we have here in Allegheny County. So I think it's allowed us, it certainly helped us in March when we shut down things much more quickly than other places did, and then kept us in good stead throughout as Dr. Bogan and her team were able to go out and pinpoint where the problems might be. So we don't want to go back into the yellow or certainly not the red phase where we were in March and April, where everything was shut down and people couldn't make a living, people couldn't do normal activities, whatever that normal is now. But at least if we can pinpoint an area, if it is just bars, if it is just travel, if it is just whatever application it might be, then you can take some action. And as she says, it's a strategic focus rather than taking just a scattershot approach and hit everybody. Because we're only a month away from schools starting to, particularly our universities that sometimes go back in mid to late August. And, we're now going to have, however many tens of thousands of college students that are coming back into our community. And we don't want to be in a bad place when that starts, because that's a challenge that we're going to have to deal with all into itself.
And that's a critical part of Pittsburgh and Allegheny County.
It is.
So you do have one accolade of shout, and then I want Jonathan to just ask a question, but I see Bobby Watt Gear saying, very lucky to have local health department under Bogan's leadership with Rich as the county executive. And she lives in a suburban county, and the information and guidance is very hard to get. But Jonathan, can you take the next two questions that are in there?
We'd be happy to. And once again, Rich, thanks for being here for your third time. You're a trifecta guest, and we really like that. And my dogs are barking like crazy right now. So this is our first question is from John Scobonis. He says, with what appears to be our second wave of coronavirus taking hold in Pittsburgh, he'd like to hear what the county will be doing in regards to contact tracing.
Well, they've got a lot of folks out in the field doing this. I think over 100 right now that are making contact with people who test positive, finding out where they were, if they traveled, where did they work, who have they been in contact with. And so that's kind of how they come to these determinations as to what was the problem. So when the numbers, they were, we'd see positive cases for the longest time to be 15, 18, sometimes 20, 25. Well, then about 2 weeks ago, we started to see 90, then over 100, then over 200. Well, when it started to hit that 90 2 days in a row, Dr. Bogan knew something was up. It was much different than what we were seeing. Their contact tracers had really come down to the fact that it was a lot of the bar activity that was causing it. That's when they made a decision to do the shutdown of that industry. Well, the numbers have still stayed where they are because it's a lagging indicator. You can't shut it down on Monday and all of a sudden on Tuesday, the numbers are going to get better. It's going to take a couple of weeks for all those tests and the virus to make its way through. Same with the things like hospitalizations. They're very concerned about seeing the hospitalizations now begin to rise. They haven't risen to some of the numbers we've seen in some of the southern states, but it is a concern because it is a lagging indicator that often follows when the tests get high. Then, of course, the third indicator, or third or fourth, would be the ICUs and then the fatality. So we're hoping we don't get to that point, but that's why they did what they did a couple of weeks ago.
Yeah. Our next question here, Rich, is do you foresee reducing or eliminating the quarantine for travel to the 19 hotspots or the hotspot states?
I don't know. I mean, the governor put out a recommendation. I think it's a recommendation. I don't know if it was actually an order, but if you travel to certain states, you should quarantine. Dr. Bogan also made a recommendation during that, in addition to the order that she made a couple of weeks ago, that when you do come back from one of those hotspots, you should either get tested within a couple of days or quarantine for a couple of weeks while you do that. And I understand they even have some testing that you can get done at the airport when you get off the plane. I believe there's a Rite Aid or a CVS, one of them are out there that you can get a test with.
Excellent.
Okay. More questions, Jonathan.
Yeah, they're rolling in. We got a big crowd here today. Absolutely. Let me see here. So here's another one regarding from Glenn Ford asking, Rich, for those traveling to Pittsburgh for business, would you suggest that we stay home?
Well, look, people are going to have to do certain things in business, and my understanding in talking to the folks in the travel industry, the folks that are traveling right now are actually traveling on leisure as opposed to business. I think a lot of businesses have decided to do the Zoom meeting, the remote meeting, that type of thing. But some businesses, you physically have to be there, for whatever reason. So there are precautions that the airline industry has taken, with wearing the masks, all the cleaning of the surfaces, keeping the middle seat open, things like that. So I think there's a lot of things that could be done. But if you're going to travel, hopefully, people could travel by car and stay isolated that way. But obviously, if you're going pretty far, you're going to have to travel by plane or by train, and you're going to be in that enclosed area.
Okay, keep going, Jonathan. There's great questions.
They just keep coming. They keep coming here. Let me see here. So this is from Ann Tumolo. She says, last week, the Post-Gazette reported UPMC's medical director of infection prevention said the strain seen in Western PA seems to be more infectious, but less virulent. Will that affect how the county decides to open or close businesses?
If that is the case, and I've heard that from others as well, but in talking to Dr. Bogan this morning, they haven't really confirmed that yet at the health department. They're suspecting that could be the case. I'm sure that will go into effect. If it's less virulent and less dangerous, that certainly is good news. The bad news, obviously, on the other side would be if it spreads easier. So I'm sure they'll do some strategies, and I'm sure nationally we'll start to see that if that is the case, that the CDC, the NIH will come out with some recommendations if what you're saying is what we're seeing.
Jonathan, there's a bunch of questions in there about, like, is there a way to report or any citations or any of the actions people are seeing people as they're walking around?
Yes.
Yeah.
And
that is good.
What do you do? Right?
You could call the health department, and I'll give you that number. We'll give it out a couple times if you want to, but it's 412-350-INFO. So it's easy to remember, 350-INFO. And just call the health department and report something that you may see, and the case investigators and the contact tracers, et cetera, will be able to investigate.
Okay, that's good information.
No notes here, that's for sure.
Is there another question in there, Jonathan?
We have so many, it's like unbelievable.
Yeah.
We're almost out of control here, and I kind of like it. What about sports? If people are playing basketball in outdoor courts, what are your thoughts? Is 8 to 10 people too much? Is this a concern?
Look, I think people need to get out and be active. I mean, it's one of the things we've done in the county and other places, have kept the parks open and allowed people to recreate, whether it's biking, walking, jogging, et cetera, fishing, all those type of things. The thing about basketball is that it's a contact sport. Right. Basketball, soccer, football, lacrosse, those kind of sports, everybody's running towards the ball. You're congregating around the ball. And, we know people don't want to wear masks. It's very difficult to wear a mask, particularly if you're running, you can't breathe as well. So I would say basketball is probably one of those kind of iffy kind of things to do. But there's other ways in which you can play basketball. Maybe you just do, play horse, those type of things. There's hockey you could do with just one-on-one, the person shooting and then a goalie, as opposed to, playing 10 people out on the court all at once or on the ice at once. So I think these things we'll learn more about. I don't think there has been an issue right now with widespread in activities like athletics and gyms, but I do think it remains to be seen, particularly as schools open up in the fall, and then you have all the fall sports. So we'll just have to see.
So Griffin Schultz, Jonathan, has a good question.
Griffin, we haven't seen him in a while. He's been a regular on our webcast here for sure. So he says or asks, what is the state of city, county, state budget? What cuts will need to be made, assuming the budget situation is challenging and you're expecting more help from the federal government, and in what form?
It remains to be seen. The one thing about, I'll speak to the county budget. The county manager imposed a hiring freeze back a number of months ago. So far, some of our revenues have been fairly consistent, like property tax, because that's more of a stable tax. But we've seen certainly our sales tax, our drink tax, the gaming tax, the hotel tax, things like that have really obviously taken a huge hit. So those revenues will be down significantly. We understand that the federal government is looking to have another stimulus package in which state and local governments will be given some sort of help. What percentage that will be, I can't speak to that. They did provide some CARES money that the county will be distributing, but none of that is for revenue replacement. That is all for COVID-related expenses like health care, contact tracing, testing, those type of things, public safety, PPEs that are being provided. So that I know that the bill, they passed one in the House. I know the Senate is working on one at the federal government level, the federal level, and hopefully they'll come together and reach some sort of compromise.
So what about camps? Are you seeing any spread from kids that are going to day camps?
We haven't, and I know camps have opened up in again, different ways than they have before. But no, that's not been one of the areas of concern that Dr. Bogan and her team have indicated. She was a little more, again, we talked about the restaurants and the travel.
Right.
And I think there was just at least a little bit of an inkling that sports and other activities like that that were starting to open up. Some of the high school teams and middle school teams that were, starting to have practice again. But nothing yet that's come to the level of what we saw with the bars.
So Rich, since the information and the data that you released from the health department, my hat's off to the timeliness and consistency of reporting that data. Where are we going to reach an inflection point? Is there an inflection point that may say, you know what, these numbers just are continuing to get to a certain level that we are going to have to retreat a little bit and go maybe into another reversion of a hybrid model?
I don't know. It's a really good question because, again, I think a lot of it isn't just going to be the test results and the positivity rate, but also the hospitalizations and the ICUs. And does our hospital healthcare system become overwhelmed with that? At this point, I think Dr. Bogan and her team feel confident on the strategic listing of the Bar and Restaurant Association areas and to asking people to quarantine or test when they travel. And thus far, that's where we're going to be. Now, we're talking a month, 6 weeks from now, we're going to open schools.
Right.
Things could certainly change when you bring, all those students to an indoor facility for 6 hours or so, that we don't know what that's going to happen. So I think there's going to have to be a lot of flexibility because I don't think there's any rules that you can say, you're going to be open for a month and then check it. It might have to get shut down right away, or it might have to get changed right away. So we really don't know once that activity changes after the end of the summer where we'll be.
So here's a question, Jonathan, if you want to take this one from Lindsay Folco.
Yeah, I'm reading my mind on this one
Yeah.
because it's pretty important. So, Rich, what is the guidance for private event sizes when private events like weddings or funerals are up to the sole discretion of the attendee to make? Why are there limitations? Is this up to the private club to instill the 50% capacity rule?
Yeah, they're treated just like any other restaurant or anybody else. Private country club or a private VFW or social club still has to follow the rules that they've put out, which is 25 people indoors and 50 people outdoors. That was a 2-week order that we're maybe 3 or 4 days into right now. So that may change as time goes on, but during this 2-week period, it's 25 indoors and 50 outdoors.
Right. And so again, if anyone sees any violations there, you can call the number of 350-INFO. Right, Rich?
And yes, and I can tell you it's affected the county executive because my son had a wedding that was planned, him and his fiance for August, and they have canceled it and put it off until next year. Hopefully things will be better. So it touches everybody.
Yeah, my daughter, the same thing. So what about the, as we wind down, Bobby Watt-Gear is back on. She's talking about the availability of testing in the county now. There are some reports of delay.
From what I'm hearing is that some of the private labs are being overwhelmed. And I don't think it's just locally. I think it's because these are national labs. And you're talking about places like Quest and LabCorp that are taking some extra days, I guess, to get results back. Used to be 1 or 2 days, and now it might be, 3 or 4 days. And I'm not sure where that'll go, if they're going to be able to ramp up, because we do see more and more tests being done. I mean, I mentioned, before when we were at 2 or 3%, 4% positivity, we were only running 600 or 700 tests a day in the county. Now we're running oftentimes above 2,000 tests per day. So you got a lot more people getting tested. Obviously, it just takes more, and you need more infrastructure to be able to do that.
So what about, do you have any priorities for the county's CARE Act dollars?
I think as those dollars, as the requests come in to from the various municipalities and various organizations, I think a lot of it's going to go to help people in most need. Human services and our social workers will be able to continue to hopefully, care for people that are most affected by this. And I think that's where most of that funding will go towards. And
then, is there a high need for plasma still? Do you know?
I don't know the answer to that.
Okay. And then just a tactical question, then I'll ask Jonathan to ask the question after. When the number of cases are reported on the health website, is that cumulative weekly, daily number of cases, including recovered people?
No.
Right. Doesn't include
recovered. It's not all, it comes in different batches. So today, for example, we had 71 cases with 750 tests. So it's still around that 10%, a little bit below 10% area. Tomorrow, we might have 2,500 tests that come in because it just, depending on how those batches come in, and we don't have any control of that. By the way, they send those to the state. All that information goes to the state, and then the State Department of Health then puts it back on ours. We reveal ours or put ours out at 11 o'clock every day.
Right.
The state then puts theirs out an hour later at noon. They do the statewide results.
Yes, thank you for being so consistent with that. Very reliable. So Jonathan, Vince is here from the airport. He just wants to make a statement about the airport.
Yeah, I'm glad Vince chimed in on this. Glad to have you here, Vince. So the Pittsburgh International Airport has a complete set of health, safety, and wellness measures in place. The behavior of those when they travel to any area by any transportation mode is separate from the actual travel experience. Although it could happen, the Rite Aid at the airport is not yet set up for any testing. Pitt works closely with and follows the county health department as it relates to its tenants and businesses. So we just want to get that out.
Oh, I'm glad Vince correct. I know there was a Rite Aid out there, and I know Rite Aid's doing a number of tests in other places around the county, and maybe that could be something we could get done as well.
That'd be great. Good.
So without Dr. Bogan here, I don't know if you can answer this, but how accurate are the tests, both COVID and the antibodies?
I think they've gotten better. I think that was one of the big concerns early on back in April and early May, that there were a percentage of false negatives where people would test negative, but that actually they might have been positive. But I think that's improved significantly. But Dr. Bogan could probably answer on the
that's
percentage
what I thought.
that would be. Yeah,
that's what I thought. So what? Here's one from Lisa, and she's at Lisa McCauley. She's asking, as a parent, how concerned should we be in sending our kids back to school in the fall?
Well, that's a tough one, because I think every school is probably going to be a little bit different. And then, what will be the plan if a child or two does test positive? How are they able to isolate and mitigate those type of things? I think that's something that the Department of Education at the state level is still working on. I know our universities at that level have some plans in place, some pretty significant plans in place, but the best laid plans don't always come about if people don't follow the rules, if people aren't wearing their masks when they're supposed to, or keeping the distance as they're supposed to, et cetera, et cetera. So it really is one of these things where we kind of know what we need to do. If everybody does it, we'll probably have some success, but it doesn't take very many folks who don't want to do it to cause the numbers to spike.
To ruin it, right? So, Rich, as we wrap up, what are your final words that you want to say just for today? Because every day is a different day for you. What do you want to say to the tech community? I mean, because many of us are working from home. We actually have the capability to be highly productive and working remotely. But we don't know how long that can last.
I know, and a lot of us, and I'm certainly with them, that have COVID fatigue. We want to get back to normal. We really do. We want to go to a party. We want to hang out with our friends and our family members. But until we have a vaccine or a cure, we're really no further along than we were in March. I mean, we're better that we know more about it and how it spreads and all those type of things. But for certain people, elderly with immune suppression issues, it's a very, very deadly virus that puts people at grave risk, and we don't want to let that happen. So I know a lot of folks in the tech community tend to be younger. Luckily, they're not as vulnerable to some of the effects if they do contract the virus, but they can certainly spread it to others. And that's it. We all have family members, and one of the things I'll say about Pittsburgh, Pittsburgh's a family town, generations. You often have the grandparents who are the child care folks for the parents who are at work. And in this case, that can be very difficult, particularly when those kids are going to school. So we just got to stay vigilant, keep listening to what Dr. Bogan and our medical experts are telling us. Stay distant if you can. Wear this mask, when you're around people, and just try to stay distant. And it's communicate this way, communicate by a Zoom, by a Microsoft Teams, et cetera, et cetera. It's not my favorite thing, and I'm sure it's not the favorite thing of everybody. But until the virus is eradicated, it's probably the new normal we have to live under.
How did we do today, Rich? I didn't see the numbers yet.
Today's number was 71.
Oh, wow.
But it was only 750 tests. So the positivity rate, a little bit improved. But again, I don't read too much into it. Tomorrow, again, it could be, we need to see, and you guys in the tech business, you need to see more of a trend than a one day blip, one way or the other. So anyway. Okay.
Well, we have extended our time with you. First of all, thank you for always being accessible. Thank you for being candid. Thank you for letting us know when you don't know the answer. And we need that, and we appreciate that from a leader. And it matters. You're a good partner and a good role model. And I know that you are working relentlessly through all this, making very hard decisions that are affecting each and every one of us. So I really thank you for that.
Thanks all you guys. Appreciate it. And stay safe.
Okay, you too.
Bye now.